Now, we first told you about it right here on In Focus. Startling news about the fight against cervical cancer. A new study showing the death rate of cervical cancer may be much higher than previously thought. And there are some big differences with ages and also race of the women. So joining us now to put the startling new information in focus is Dr. Pallavi, Kumar, medical oncologist from Franklin Square Medical Center. Thank you so much.
Thank you for having me.
Tell us what's so unique about this study. They looked at something that they didn't normally look at in the past.
Yes, so this study in particular actually looked at women who had their cervix. So in the past, they took out women they looked at everyone. So they had their cervix or hysterectomies, they were all included. So this one particularly looked at women who still had their cervix. So when they did that, they were actually evaluating disparities based on age and race. And so the results of this is that cervical cancer death rates were increased in patients that were older and Black women. So this for all of us was somewhat startling.
Definitely, and this is, we're wrapping up Cervical Cancer Awareness Month. Why is a study like this so important?
You know, cervical cancer is preventable. So for me as a medical oncologist, I find that when we can prevent a cancer, such as cervical cancer, we want to promote Pap smears. We want to promote using and discussing vaccines. So these are the kinds of things that are important. And in this particular study, when we see women over the age of 65 having increased death rates, one of the things that concerns me is a lot of the women that I have that are over 65 often tell me they no longer have Pap smears.
Screenings anymore.
No more. And that's guidelines. They no longer are having these examinations. And so maybe this should change the way we think about screening. And finally, when we see a group of women that are falling into a category with increased death rates, we really need to think about, are they not being screened?
I was going to say, why are we seeing the increase, but you think with African American women?
We're not screening them, we're not following up, are we not treating them properly? And what about access to good health care?
Okay, all right, so make sure you get those screenings. Is it a yearly or every 2 years?
You know, it depends on what they find and your age, but you know, screening Pap smears, I'm a huge advocate, and I really would like to make sure that people talk to their doctors. Children can get vaccines from as early as age 9 to up to 26, boys and girls.
HPV vaccine.
HPV.
Still controversy or not so much?
I think there is controversy, but I think at least having dedicated discussions about this is really important. You know, for me, when I see deaths from cervical cancer that can be prevented, it's got to be discussed.
All right, Dr. Kumar, thank you so much for coming.
Thank you for having me.